making it crucial to raise awareness about it and take necessary preventive measures. So joining us today is a renowned expert in the field, Dr. 𝗗𝗵𝗂𝗵, an ENT surgeon at the 𝗘𝗵𝗴𝗶𝘀𝗵, who has handled numerous arrow injury cases in the country. And doctor will lead us on the different types of arrow injury cases, their severity, and the crucial steps to take post-injury. And doctor will also guide us on the emergency services available in the country to handle such incidents. So stay tuned as we discuss this important topic and learn how to prevent and respond to arrow injuries. So thank you so much, doctor, for joining us today. So to begin with, can you give us like an update or the number of cases of arrow injuries reported till date in the country, and also why the surge in the cases of arrow injuries lately, because 10 years ago there was not much incidence or report of arrow injuries. So why this increase in the cases lately?
First of all, good evening to all my fellow Bhutanese.
Yes.
And secondly, thank you, 𝗘𝗴𝗏, for giving me this opportunity to clear up or discuss on arrow injuries in our country. When we say the number of cases of arrow injuries in our country, to be frank, I do not have a definite figure of how many arrow injuries. So if I tell from the experience, especially to ENT, the Department of ENT deals with arrow injuries above the collarbone. All the arrow injuries that's happening above the collarbone are being referred to our department. So as 𝗘𝗏, you have mentioned, over why we are alarmed. Arrow injuries do happen. It has been happening for so many years. But why is alarming? Why is it alarming? Is over last year, over a period of 1 month, 4 critical arrow injuries to the neck and face came within a period of 1 month. So it's quite alarming and extremely life-threatening. Fortunately, none of the patients did succumb to the injuries. All of them got better, though with some functional deformities. So arrow injuries, if we do a literature review or literature survey, there are no good papers or papers with large number of cases where arrow injuries are reported, and it's understandably because arrows are being used for a long period of time since the age of Stone Ages for killing, but killing and for during the warfare. So arrow injuries definitely would have been there. For arrow injuries due to sports, I think is mainly in Bhutan only. Till now I haven't seen any good paper saying that sport-related arrow injuries to the body. So myself and my colleagues did some literature review, and then we have written some papers on the arrow injuries, the experience in Bhutan, how we can prevent it, what were the cases, what were the injuries we encountered, how we managed. So globally there is no as such paper I have seen as of my knowledge, but in Bhutan also one of my colleagues from general surgery department was trying to do a study of number of cases of arrow injuries. I think that paper is not yet out, maybe in the future it will be out. But from our perspective, this year also few cases came, but not alarmingly like last year, whereby at the month of October 4 cases of arrow injuries, very critical arrow injuries in the face and neck came.
So what are some of the common types of arrow injuries that you encounter?
So when we say arrow injuries, in Bhutan we use 2 kinds of bow. One is traditional bow, which is made of bamboo, and which is much safer because the amount of force that they generate is much less compared to the compound bow. A compound bow with a metallic arrow has tremendous amount of force, and if it hits a very critical area, I think we all know that there are cases of death being reported. We know that I think all of us know that few of our colleagues or few of our friends, or we might have heard there are cases of spot death. And as recently, I think one of the patients died on the way to in Thimphu itself because of an arrow injury. So there are two kinds of arrow injuries, to be general. One is because of from the bamboo and our traditional bow, and other one with the compound bow. So other thing is, even with traditional bow made out of bamboo, people tend to use metallic arrows. So these are the two things. The head neck injuries are very few cases of 𝗗𝗴 injuries are coming.
Yes.
And fortunately, 𝗗𝗴 injuries being shot by a human hand do cause some injuries, but it's not as life-threatening as arrow injuries.
Yes. So, doctor, what differentiates arrow injuries on the head and neck and the arrow injuries that occurs in the different parts of our body? How is it different in terms of severity and complexity while managing?
So, to go with all the arrow injuries are severe, but among the severity, arrow injuries, especially to the chest and neck, is extremely critical. Why we say critical is because as a human body, an adult male, say weighing 70 kilogram, or for keep myself an example, I might be having 5.5 liters of blood. And for yourself, you might be having 4.5 to 5 liters. So if we lose 1 liter of blood over a very short period of time, say within a half an hour period, you will go into shock. Your blood pressure will drop. So why we are worried is, so especially chest and neck is full of major blood vessels. All the blood vessels going to the brain and face goes through a very narrow area in the neck. On top of that, our neck contains a breathing conduit for called as trachea. So if it hits the trachea, if it causes any swelling in the trachea and blocks it, the time duration for patients to get transported to the hospital, by the time the help comes, it might be too late. So especially, I'm not saying the other injuries and other body parts are not very severe, but when I'm saying, what I'm saying is, those critical areas, the time, and if you do not manage properly initially, the chances of you dying is quite high. So these are the two critical areas. Also, especially in the abdomen, if it's right at the center, right at the center, around your navel area, and if it's hit by a compound bow, likely the huge vessels are being hit. So never ever try to pull it off.
So, doctor, in the event of such accidents or incidences, what can people around, what role can people around play? What are the things that they can do? Any emergency preparedness tips that you can give? And what are the things they can do and things they should avoid in the advent of the incident?
So first thing, if one of your colleagues or your fellow player gets hit by an arrow, number one is do not get panic. So during the time of panic and anxiety, so many wrong things do happen. So people tend to panic. So first of all is to remain calm. And I'm sure that in any major archery league, there is a team leader. The team leader should lead. And he should activate. First thing is to not to take out or not to pull off the arrow, unless the arrow has hit a very superficial area, especially your scalp. There's just the covering of the skull, or just it is pierced to the skin, and if it's just hanging, then I could say it's fair enough to remove. Otherwise, any arrow injuries, any part of your body, especially in the chest and neck area, if it is firmly attached to the body, please do not remove. If you remove, if you're unlucky, then and if it has hit a major vessel, you just bleed to death.
Doctor, any bleeding control and basic first aid they can perform?
Definitely they can do. So in case if the patient or if the victim has withdrawn the arrow, and if there's a profuse torrential bleeding happening, the first thing you can do is, with the help of a clean cloth, you just give a very direct, firm pressure and keep on pressing
Yes.
till the bleeding stops or till help arises.
Yes.
So if it is a superficial area over the thigh or above the, in the neck even, you might able to control. But if the bleeding is within the chest, within the thoracic cavity or within the abdomen, and if you have withdrawn, and if there is a bleeding, the patient is going to shock, the only way to save him or her is lift him as soon as possible to hospital, because there is no way we can give direct pressure there.
Yes.
Because it has a lot of cavity inside, so our force will not be able to reach that particular bleeding vessel. So in the chest, abdomen, neck, you have some chance because we have a spine behind. So if you can press firmly against the spine, so there's chances of bleeding. So do not leave that force, keep on pressing, call for ambulance if needed, air ambulance, and lift to the nearest hospital as soon as possible.
Yes. So doctor, are there any designated team for such emergency cases? Maybe like a specific team for arrow injuries?
As such, we do not have.
Yes.
It will go department wise, as I mentioned before. If any arrow injuries is going above the clavicle or the collarbones, usually the emergency department will notify the department ENT.
Yes.
If it deals with the chest, then we have a newly joined cardiothoracic surgeon. He or she will be notified. If it's an abdomen, the general surgeon will deal. If it's dealing with the limbs, with the bones, the orthopedic surgeon will deal.
Yes.
And if it's dealing with the spinal cord, brain, and many times arrow injuries, management of arrow injuries involve multidisciplinary team.
Yes.
So if it's hitting the face especially, so ENT department, ENT is being called. We even call dental department to look for any bone fracture, how to repair it, and we involve the ophthalmologist if there's any signs indicating injuries to the eyes and vision, and if it involves the brain, we definitely involve the neurosurgeon. So it usually is a multidisciplinary team.
Yes. So once the victim, or the patient reaches the help, what is the typical treatment protocol in Bhutan for arrow injuries?
So the main treatment is to remove the arrow. So the thing is, how safely can we remove the arrow? Our principle of management becomes to remove the foreign body,
Yes.
that is the arrow, with minimal injury to the vital structures and save a life. Just pulling off the arrow, anybody can pull it off.
Yes.
Anybody can pull it off. But once we pull the arrow, can we save the life? Or are we going to save the limb or the vital structure? Many times, it is a very, very strenuous, stressful experience
True.
for the doctor, the
As well
surgeon, as well as the patient and the patient party. You don't know what's going to happen. Moment we do all adequate investigation like CT scan, and sometimes an MRI is also needed to make sure no major vessels are being hit, because the advantage of getting operated in a higher center is we go well prepared. We do reserve a lot of blood. We involve our colleagues whom we can always lend a helping hand at the time of emergency. So the principle of management: remove the arrow in a save the life, save the function.
Doctor, what about inclusion of patient and patient's family in the treatment management? Are there any psychological counseling that is given to patient parties before the treatment?
Yeah, lot of counseling is indeed needed.
Yes.
Because a victim
But
of
are there time for that? Because
definitely there is time,
Yes.
and even if we do not have time, we should provide a time for counseling, because counseling plays a vital role here in this kind of situation, because a victim of an arrow injury is not a patient.
Yes.
He or she had been an absolutely normal functioning human being before he was being hit. So in an event of a death in such a healthy patient, the repercussions to the family, the amount of stress to the family is quite huge. So what we do, we basically call few of the family members and counsel them that what what we have found, where is the arrow lodged, what are the risks involved.
Yes.
Then we even brief them that it can go to the event of death on the table. So we do get a high risk consent because they might accuse us that you did not inform.
True.
And fortunately till now in our department none of the patients did succumb to any injuries, though few of them have some functional deformity like loss of smell, loss of sensation over the face and not able to feel anything. But anyway, no major functional deformity had happened.
Yes. So this leads to my next question. So what are some of the potential complications of arrow injuries after the treatment or surgery?
So the potential complications especially will go, the kind of complication that will come after arrow injury will depend on the side you are being hit.
Yes.
For example, first let me discuss from my department perspective. If you hit the neck, a patient came all the way being hit just right at the center. It has just pierced the windpipe, but it has not gone through and through. So, and unfortunately he has withdrawn, pulled off the arrow, but he is fine. Another patient came, hit exactly over the windpipe, but good thing is he have not withdrawn the arrow. So good thing is he has come from a quite far remote place, was airlifted. If that particular patient has withdrawn the arrow, the chances of bleeding inside the windpipe was quite high. So he might have a lot of respiratory distress that even might have led to death. But fortunately he came with arrow intact, and good thing I think our patients or our this population is learning the first aid method, so they have made the arrow short. So the complication will depend on the side being hit. So if you are being hit in the neck is a passage for a lot of blood vessels. If you have hit the blood vessel, the chances of dying is quite high, even during the time of being hit and during the removal. If we can save that part and we have not hit any nerves, it's usually fine. And if it hit the nerve, then patient can develop weakness. If it hit the spinal cord with a compound bow, and if it gone through the spinal cord, you might develop the weakness of the one side of the arms and legs. There's one complication. And in our case, quite a lot of patients came with arrow injury above the eyes and in the nose. The risk there is nose and below at the level of eyes, we call it skull base, which means the floor where our brain sits. So if it breaches there, the brain liquid, we call it cerebrospinal fluid, CSF, it can leak, and that can cause meningitis, brain abscess, so many other complications. So that's why those being hit above the eyes and right at the root of your nose, we give them a prolonged antibiotics for at least 10 to 14 days to prevent brain infection, which we call as meningitis.
Yes.
So, and if it hits the orbit or the eyeball, eye socket, the chances of being blind or even direct globe injury and rupture of eye and complete loss of vision is definitely there. And if it hits the side of your face, we have something called facial nerve. If it hits and pierces through that, then one side of your face will become completely weak, and thereby when you talk, when you smile, there will be dripping or pulling off your face, and there can be facial weakness. And chest, definitely you can the chances of you dying quite early is very high in a chest injury, because chest has lungs, we have heart. If it's hit the heart, and if you pull it off, 100% confirm you'll die in a few minutes time. But if you have not removed, we all know that one of the patients got saved. We airlifted to India, and even in India they have that this kind of surgery is very rare. They have even reported in one of their articles that very rare operation has been done whereby an arrow has been removed from the aorta, the main artery supplying the body.
So doctor, what about retention of the normal structure and anatomy? Because many of the cases post surgeries that we have seen has like normal structures. So how does that happen?
So when we say usually arrow injuries are very pinpoint injuries, so it doesn't leave a big scar. So we are not worried of the scar. So even in the face, scar is very minimal.
Yes.
But the thing is, if it hit the nerve, in my patient, it has hit here. There's one nerve supplying the whole half of the face. So it has just gone right through the nerve.
Yes.
So even after removal of the arrow, that nerve did not heal well.
Yes.
So what's happening? Nothing much, not life-threatening, but he or she is not able to feel the face. So numbness, even if cold, heat, whatever hits, is patient is not feeling. Other one has complete loss of smell.
Yes.
He or she has lost smell. We have been training him how to regain the smell, and it is unfortunately unsuccessful. But let's wait. We can give time at least up to 1 year to heal. Our body can still heal. So one patient has completely lost the smell. So he is not able to smell anything, and the sensation of smell is quite important.
Yes.
Not only for your eating and what you say now, fragrance, but also for his safety. If something is burning in the room, or if there's gas leakage, if you're not able to detect, it do have a lot of implications for your safety wise.
Is there a risk to digestion complications associated
Definitely,
with digestion as well?
especially if the arrow has gone through your esophagus, the food pipe,
Yes.
and if it's gone through and through, so we keep the patient without food for at least 7 to 10 days for it to heal. But when any body structure after injury, when it heals, it doesn't heal like normal. There will be some fibrosis. So if there is some improper healing with a huge scar formation, then patient can develop swallowing deformity. As long as if it hit the stomach, and if the arrow has been safely pulled off, I think it per se, arrow injury per se may not cause any digestive issue.
Yes. So what are sorry. So what are the lifestyle modifications or dietary habits that they should follow post-surgery? Like doctor said, it might vary with the type of arrow injuries they have witnessed. So any like maybe you can sum up and in maybe like generalized lifestyle modifications.
So as such, after an event of an arrow injury,
Yes.
there is no definite dietary modification that patient needs to do, unless a specific organ has been damaged.
Yes.
For example, if it's hit the liver, and if bleeding has been controlled and liver is repaired, there's nothing much. Even if it's hit the gut, your stomach or intestine, nothing much. There's no as such dietary modification that patient needs to do. The more important thing is now how we can prevent these arrow injuries.
Yes.
How can we prevent this? What are the situations that have led to arrow injury? So if I describe, see, from the 8 or 7 cases that we have seen in our department, 3 or 4 of them has been hit on the face for just peeping from the protection shield. I think as given in the Bhutan Indigenous Sports and Association, they have their, if you read through, there are very good rules and regulations being given. If we do follow that rules strictly, I don't think any arrow injuries we need to deal with. But unfortunately, who is there to monitor that?
True.
Whether these rules and regulations being observed. So each side of the target, there is something called protection shed. So 3 of the patients, 3 of the victims got hit for just peeping from the protection shed, because after they have done whatever chum and all, the other side was not releasing the arrow.
Yes.
So arrow was not coming this side. So just to see whether they have released, moment they peep out, they have been hit. So if that was the main reason. Other one, there was a gap between the protection shed. It was made of wood planks, and in between the planks there was a gap. Through the gap it is hit. Very unfortunate thing. Other one got hit, he didn't know how he was hit. So which means definitely he or she was under the influence of some alcohol. So as per the 𝗵𝘂, alcohol is strictly prohibited during games.
Yes.
But I think if somebody is not there to cross check or monitor the players, whether they are under the influence of drugs or alcohol, definitely these things is going to happen. So we need to monitor this. And good thing is, none till now, whatever case has been reported to Department of ENT, arrow injury victims are mainly the players, not the spectators, which is a good thing, which means almost all the players were hitting the arrow within the range, not out of the range. So they were not being careful. So if you lose concentration and focus, because one of the victim got hit because there is a disturbance going on. When you play a game, somebody, that is our tradition. When some opponent team plays, the opponent team comes and disturb. But how, from which distance we can disturb? What are the level of disturbance you can do? I don't think there's any clear cut. I think there in 𝗵𝘂𝗶𝘀𝗵 I saw some rules saying that you're not supposed to touch the person who is shooting the arrow. But at times they are I think touching, and if you lose focus and if you shoot in a wrong direction, or it goes way deviated from the target, might be hitting the patient. So especially the players should find out or come out with some some kind of methods or some kind of solution. How can they prevent these injuries? Since majority of the 8 cases, 3 or 4 came because they are peeping out from the protection shield. How can they see whether the opponent team has shot the arrow from the other end? I think with this amount of modernization, digitalization, I think putting a good camera system can save it, like CCTV camera on each side. I think they can afford. So if you can put CCTV camera, they can see, okay, the opponent team has on the other side has shot, so they can go around. So it might prevent a lot of injuries, plus it can save life. Others, alcohol, and I think the law enforcement authority might have to look onto that. I think 𝗵𝘂𝗶𝘀 has well set rules and regulations. How good we follow is in the hands of players.
So it calls for stringent monitoring of the existing safety regulations that are there for archery matches or competitions. So Doctor, we have not much time left, so if you have any key messages to convey to our viewers, please do that.
The key message in an event of arrow injury, we say in medical terms, impaling object, anything that is stuck in your body, not necessarily need to be arrow. For example, you had a fall and some sharp bamboo is hit and stuck in your body. The first and most important is never ever pull it off. Never ever pull it off. Okay, so that is the most important message I want to pass today. Second thing is, now how do we transport? You have to transport the patient to the nearest health facility as soon as possible. Never ever assume the injuries to be minor, because it might be hitting a very vital structure. So for that, for the sake of transportation, to make it easy, you have to make the arrow as short as possible. So how do you make sure? You have to cut it off. So when you cut it off, so for example, imagine this is a body. If the arrow is hitting, so you hold the base of that arrow tightly and firmly, and use whatever method to cut that arrow short, knife, scissors, hacksaw blade, whatever, with minimal movement. Because with each movement you make it, whatever structures the arrow tip is injuring is going to become worse. For example, if I give an example, one patient got hit in Punaka. When they were transporting, the arrow was not cut short, and the arrow was hitting the fence. So by the time patient reached the road point, patient has collapsed because of bleeding. So you have to make it short, and if there's any active bleeding, pack it with a good amount of cloth, cover it, make it tight, and transport as soon as possible. Never ever remove the object.
Doctor. Thank you so much, Doctor, for your time today. So in today's episode, we discussed the unfortunate but common occurrence of arrow injuries in the country, which is often caused by unsafe archery practices. And today we were joined by Dr. 𝗂𝗵𝘂𝗵, who have kindly shared his valuable insights from his experience with various arrow injury cases, highlighting their severity and potential complications. Doctor also emphasized the importance of immediate response treatment options, associated risks, and some of the success stories of recovery. And we also discussed the need for stringent monitoring and stricter safety regulations for archery competitions, and also to strengthen the services for arrow injury victims, including infrastructure development, awareness campaigns, and social and cultural support. So that is all for now. Thank you so much for tuning in. Until next time, take care and goodbye la.
미담에 데베 튼드 두세 데베 신이라 아니 버들로 다 냐기디 해마 거린 탑들로 고 명엄 입지 든 게데지기 자마톡데 다 디주에 가이기 루주 거르슨 버진 고 명엄 두 든지 유세 데베 루주 고이세 데베 신이라 아니 버들로 가데베미나 다 루주 고다디 해마 잡베 냐기디스 남선 슈이미 개고이미 해마 잡베 유세메 데 라루치리 해마레 자마토면세 디날 자마톡디 두 세데베 신이라 다니 버들로 레림 심수기 아자라 살만 종 하나로에 때 아타 할로베 해마 가 임베 때 남섬이 민두스에 쪼두 냐기두스에 디날로 쪼두 다니 버들로 레림디 남메 섬이 쪼체도베 종노이기로 유스 주니라 살만 종 가기